Did you know that Alzheimer's disease and dementia are not one and the same? Dementia is an umbrella term that encompasses more than 100 causes. Dementia is a group of symptoms that appears as a result of damage to the brain. This damage causes a loss of intellectual abilities. It impairs one's ability to use his or her mind. Let's break down the term dementia. D meaning without, ment meaning mind, functioning without your mind. While dementia does cause memory loss, for one's condition to be considered dementia, there should be a loss of memory and the loss of a functioning ability. This is noted when a person's life is altered and they are not able to do the things they used to do, such as making a bed, scrambling eggs, or driving a car. Getting lost in familiar places is also an indication. Dementia may be a cause for the cognitive loss. However, as we move further in the video, you will learn there may be other causes as well. Now on to Alzheimer's disease. Alzheimer's disease is a progressive disease that is irreversible and untreatable. Alzheimer's destroys one's brain cells. This destruction affects a person's memory, thinking, communication, and their ability to carry out basic activities of daily living, such as bathing, dressing, and eating. Alzheimer's disease is the most common cause of dementia. This is why you hear the two terms often used together. Currently, there are over 5 million Americans living with Alzheimer's disease and related dementias. Alzheimer's disease and dementia are not a normal part of aging. However, age does play a key factor. Studies show that age is one of the greatest risk factors for Alzheimer's disease, between 60 and 90 years of age. Along with age comes cardiovascular concerns, such as maintaining a high-fat diet and lack of exercise. Also, studies show that African American and Hispanic populations are at highest risk for developing Alzheimer's disease or related dementias. Common characteristics you will see in a person living with dementia are confusion, disorientation to time and/or place, recent memory loss, such as not remembering if they ate breakfast that morning. They experience concrete thinking as well. People living with dementia experience difficulty understanding why things are the way they are. Therefore, what they believe is real. Also, they are uninhibited. Whatever comes to their mind to say and do, they will say and do without regard to anyone's feelings. These characteristics are caused by the disease process. As dementia progresses, you may see personality changes and mood swings. You may also see more of a depressive state. They may exhibit hallucinations and delusions. They may become more agitated and experience a heightened level of anxiety. They may begin wandering, misplacing items, and accuse you of stealing them. Oh yes, I know it all too well. They may refuse participation in activities of daily living, such as bathing, dressing, dining, and even walking. One very important note about dementia is that it could be caused by a reversible or treatable condition, such as an infection, maybe a urinary tract infection, commonly known as a UTI, poor nutrition, maybe a B12 deficiency, beginning a new medication, side effects of current medications, or interactions between medications, including vitamins, herbals, and salves. Constipation and dehydration could also cause reversible dementia, as well as depression and delirium. These are all conditions that can be treated. When we look at the drug treatment that is prescribed for a person diagnosed with Alzheimer's disease, the medications prescribed are not to treat the disease. Remember, Alzheimer's is not treatable. The medications are prescribed to manage the symptoms of the disease, which is dementia. As caregivers, you want to employ non-drug treatment as much as possible, such as reminiscence therapy. Try using pictures that are representative of that person's life over time, and try music therapy. You want to play and sing songs that they enjoy and that remind them of happy times. Remember, dementia is an umbrella term, and there are over 100 causes of dementia. So when the doctor tells you that your loved one has dementia, always ask, what is the cause, so that your loved one gets proper treatment. Your role as the caregiver is to attain the knowledge, provide awareness, and promote understanding.